All right. Well, thank you so much for joining us here today on Monday, November 24th, 2025, for the Incarceration Prevention Reduction Task Force and Law and Justice Council meeting for November. We've got some interesting discussions today and looking forward to your participation in those discussions. We've got some good uh, folks to lead those discussions. And I am going to start with the land acknowledgement. And I would ask that, oh, and I would also like to say uh, uh, I'm starting this meeting off on behalf of my wonderful co-chair, Heather Flaherty, and myself, Peter Fraser. So let's see. I'm going to read the land acknowledgement, and I'd love for you to really listen to it. I know it kind of becomes rote, which is a very unfortunate aspect, I think, personally, of land acknowledgements. I think they're important. And we're going to have a bit of a discussion around new language in this meeting today. So, as I read it, just listen to it and pay attention um, again as you can in a fresh way. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people, who've cared for and tended this land since time immemorial. Truth and acknowledgement are crucial to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge that what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that brings us together here today. And please join us in uncovering such truths at any and all public events. All right, we'll call the meeting to order. And let's see, we have a new member. I want to see if she's here.
She's not here yet.
Oh, she's not here yet? Okay. Mike Hilly's replacement for EMS manager is Deborah Arthur, and I just wanted to, when she arrives, or if it's this meeting or next, I'd like to introduce her and then kind of go around and introduce all ourselves, because it's been a little while since we've done that. Okay, our first discussion of the day is on the sequential intercept map. Um, and I'm going to turn this over to Dean White.
Okay, what I want to do is, before we begin a discussion, is to just give you a quick review of the most recent iteration of the sequential intercept map that was created back in 2022, just to give you a sense of where we are at this point. So I'll share my screen. Are people able to see that? I know you won't be able to read the fine print, but
We
just
can see it. Yep.
okay. So the sequential intercept model was used as a framework back in 2022 to lay the foundation for the kinds of projects that would be proposed in the use of levy funds and other improvements to the overall criminal legal and behavioral health system in our community. And the results of that work were three tables. The first one you're seeing here, and laid out across the top are the various intercept points, and they're labeled underneath the named intercept. For example, the community services as an intercept zero, the things that might be done to prevent a person entering the criminal legal system. The first intercept is when a person has contact with law enforcement. Then the next is initial detention and court hearings initially. Then the next one is the more involved interaction of a person with courts and jails. The fourth intercept is reentry at the point the person's coming out of incarceration. And the fifth one tries to describe the things after incarceration that can prevent reincarceration by providing people with the supports they need in the community. This product from 2022, I would say, is primarily a structural analysis of what services were available at that time in the community that one would propose or suppose would uh, catch a person at each of those intercept points and bring them out of that flow in the legal criminal legal process and into alternatives for them to gain stability again in their lives. I've highlighted a few, though, that I think are a little bit different than simply the structure of here's a service that might work at this point if somebody were referred to it, to also indicate that, for example, in blue under Intercept 1, there was the notion of providing some specialized training for law enforcement and first responders. The notion being the assumption that if those kinds of trainings were done, and they have been done in this community, that would have an impact indirectly on a person being diverted at the first point of contact with law enforcement. In the left-hand column, Intercept 0, many of those items are they were in existence at the time, but aspirational in terms of how their impact might come to bear on future contact with law enforcement and ultimate incarceration. Then the ones in green are those activities which, and this is not, they aren't all the examples, but I just highlighted some in green that were examples of some process improvement that might have the effect of diverting someone at a particular intercept point. For example, under Intercept 3, there's a reference to district court high-risk DV unit court text messaging, the implication being if there were better communication somehow among the various components in the system, that would result in a diversion at that intercept point. Just quickly, I'm going to scroll down because it's really a much more complex document than this one page shows. Of course, the first table is those things which, as it says, somewhere it says on there, exist now and in sufficient quantity to have an impact on diversion, and it runs over to a page and a half. The second one is those things which do exist now, but perhaps not in sufficient quantity or capacity to have the impact that we'd like to see. And you can see this is a document that was still being edited. There were some that were put in initially, then crossed out, and others that were added toward the end, all of which implied that there were things that we could do additionally to make the diversion process happen. And then the third table was those things which, in the view of the people who put these things together, do not exist in this community, but if they did, they would have an impact on diverting people at the given intercept points. So before I move on to the next thing, just want to check and see if there are any just informational questions or description questions about what this intercept model intended to convey. And Jill, I'll rely on you to let me know if there are particular people with questions.
I don't see any hands raised.
Okay, so now I'm going to share a different screen. And this is a document that was provided to us by the Administrative Office of the Courts at the state, just simply indicating what in a very simplified fashion, a sequential intercept map would tell us or do for us in our efforts. And it doesn't look like I've got the right screen. Hey, can everyone see that? Okay.
We can see it.
This is a very simplified version of what I just showed you earlier in terms of the various intercept points, but you'll notice that there is more of a focus in this map, as an example, of not just structurally what exists in a given community, but how sort of the work flows, or the people who are being impacted by our system flow through the various intercept points, and when the diversion opportunities might occur to alternatives. And again, it's a very simplified example, but its real focus beyond structure is to the way in which the resources that we bring to bear in the community can actually operate or function to divert someone from the primary path through the criminal legal system. And so, for example, in Intercept 2, you see at the point of first court appearance, there's an arrow that moves up into specialty court, which is considered Intercept 3 service, but it's an alternative to the usual course of a person going into jail and then having their case disposed of. And so I think the reason that I mentioned this is that while we've had primarily a structural analysis of what things we have and what things are missing in order to divert people, this really focuses more on what's the flow of activity and how does it work to, if we were to flesh out, for example, the what goes on in that arrow from first court appearance to specialty court. If we were to flesh that out in terms of procedures and operations, how it would actually happen that a person would be diverted at any given intercept point into an alternative. So that's a basic frame. Again, any questions about this particular map and the distinction I'm making between structure and function? Okay, so let me do a final screen share. And this is simply a set of questions that I think we'd like to have the discussion today focus on. First of all, what is the product you hope to see coming out of the 1.5 day sequential intercept mapping workshop coming next February? And what is the use you hope will be made of the SIM workshop product? And let me just give you an example of that second question, something that has occurred recently in a different but not unrelated system. And that is, there have been some agencies who have been looking at what is the process by which a person who is voluntarily ready to go into inpatient psychiatric care, what's the process by which that occurs? And there's been some good work done to look at the current flow and how, where the barriers are and what keeps folks from actually being able to get into inpatient care, and then what kinds of protocol or procedure changes might occur. And I'm hoping hear more about that at the December IPRTF meeting when there's a further presentation on what that process change has been and how it's impacting the ability of folks to get inpatient treatment in psychiatry. So, Peter, I'm going to turn it over to you and leave these. Do you want me to leave these questions up, or do you want me to?
No, I think we should all be able to see each other's faces. That'd probably be better.
Okay. So take note of the questions. What do you hope to come out of it, and how do you want it used?
Yeah. And I guess I would add one other thought. It's like if you could, as you're thinking about these things, think about your work and what process and system uh, failures or hurdles do you face that we might put focus on to build out a better continuum of care. It's if you can think of some examples in your own work, um, and hopefully your question number two will be able to get to this. So who would like to begin? Any thoughts? Barry, please go ahead.
Morning, everybody. I think what's going to be important is how we could use this update to update the implementation plan. I think the timing is really perfect. I think we're going to get the intercept model updated, and we're going to want to be looking at the implementation plan next year. So I'm excited that this is all happening in a kind of an orderly fashion, and yeah, couldn't be pleased more. So,
Thanks, Barry. Who would like to go next? Raylene.
Thank you, Peter. I appreciate all the work that's gone into this, so thank you on that end. One area that I think we're already working on, but it would be nice to be able to put in the sim is what we have barriers on now with our current facility that we have struggles on meeting some of the needs that will be able to be implemented when we have the new jail up and running.
Great. Thank you. Who's next? Hi, Alexis.
Hi,
Please go
good
ahead.
morning.
Good morning.
I'm thinking about this, of course, from a substance use disorder inpatient treatment perspective. And one of the largest barriers that our clients encounter at times are not enough capacity within the various treatment programs, especially for the one that I direct currently. We have been at 16, which is our full capacity, pretty consistently for the last 4 to 5 months. And one of the things that we see is sometimes some expectations around these quick turnarounds. So all of a sudden it's, hey, this person is being released from jail in, maybe a day or so. Is there any way we can do a direct transfer into treatment? And that's just not realistic when the demand for a service is beyond what our capacity is. It's a good problem to have in that this program was not experiencing that problem in years past. However, I'm interested to see in this workshop different creative solutions to those barriers for folks that especially don't have a stable or safe place to sleep at night, to make sure that they're maintaining what they need to in those interim moments. Within our organization as well, I'm making sure that we are getting creative with our solutions to that and looking at some other options to provide folks a safe place to reside until they can get the services they need.
Thank you, Alexis. And for those who don't know, would you just name your program, please?
Yes, sorry. Men's low intensity residential over on Girard. So if you ever want to check it out, let me know. We're doing some very cool stuff here.
Fantastic. Thank you so much.
Thanks,
Maya,
Peter.
go ahead.
Hi, good morning, everybody. A revised and updated sequential intercept, I think, would really help with communication and setting up expectations, responsibilities, and defining, like what working groups, what bodies who are doing this work need to be communicating with each other in order to effectuate these things. Thanks.
Great. Thank you. Who's next?
I'm happy to pipe in. This is Melora with Health and Community Services. I guess I am very excited for this process and very excited that we're going to be supported by AOC. I think it's really going to help the engagement piece and have it be a more comprehensive SIM. I think that we are moving into a time of lean funding. And we're going to have to make some very difficult decisions as a community in the next couple of years. And so I think I just want to put that out into the air of as we are reviewing and doing our needs assessment, we're also thinking about where the recommendations of what we would choose to continue. We're going to identify lots of new needs as well, but how do we manage what we already have going in our program, like treatment centers and different programs. And so I think as a body, if we can just continue to be as vocal as possible on what the IPRTF would like to see in terms of investment. And this needs assessment is going to give us a lot more information while we're having to make difficult decisions about funding.
Thank you so much. Chief Mertzig, please go ahead.
Good morning. It's for me, this is in a law enforcement perspective, obviously. This is drastically different with our current system versus a new jail. I think that in order for, and this is going to be broken record for me, but in order for diversion to be truly effective, we have to have something to divert from in our when it's a law enforcement encounter. I have to give my folks options. They have a true heart and desire to keep people out of the system, but there has to be an alternative to jail. And right now it's just there isn't a capacity for that at all. So again, it's that having options to choose from. And right now, folks, more likely than not, are just going to be released, and then we're not able to have a positive impact.
Thank you, Chief Mertzig. Mayor Lund, please go ahead.
Good morning, everyone. This is great. I think my comment would amplify two pieces that have already been spoken to about capacity in existing programs and services, and also the financial landscape that we're in. And as we go through this updated process, understanding those programs where we feel we need capacity across the whole system, but really what is efficacious and where would we want to make investments to grow the capacity? And I guess asking some of the questions about what might be less efficacious or what we might have to edit, and getting some framing around prioritization in case we have to make some harder choices.
Thank you so much, Mayor Lund. Bertie, please go ahead.
Yes, I had a question, really a clarification for Chief Mertzig, when she was talking about the need for options and the fact that it's limited with the current jail. Are you talking about booking restrictions primarily, so that officers don't have any impact at diversion because the person's just going to be released, or was there something else behind that statement as well?
Yeah, that's absolutely having to do with booking restrictions. Right now, women in our jail are not able to be booked unless it's a violent felony. And so even if we are to encounter them right now, and there's an opportunity to say, well, instead of jail, we could go into this treatment program. It's just not they know that jail is not the option, so they'd rather go free, which who wouldn't, right?
Okay, thank you.
Who'd like to go next? I'm sure that there are some folks there. Maybe they're shy. Maybe they want to sit back, but I'm not going to let you. I'm going to start calling on people. This is an important discussion. I'd just love to hear what you're thinking, even if you're haven't had your second cup of morning coffee. So, all right. Thank you, Arlene. Please go ahead. Arlene, you're muted.
You're not going to like what I'm going to tell you right now, but I want to bring up the fact that everybody is covering up that we are not, there is some question about whether we're going to have a 23-hour crisis clinic. You're saying it, but you're not saying it. So, well. It's the answer to the chief, what you just spoke about. Some place for people to bring community, and before they've committed a crime and are troubled with something, a plan will be made, the beginning of therapy will start for some people. And I think it's essential. I don't think we can eliminate it from our plan because we said that we were going to do it. And I don't think we should break our promise to the community is asked for mental health care. That's not the jail, that's the wider community. Everybody can walk into this clinic. Anybody can walk into this clinic and get immediate care and a plan for their future. Nothing else in the program is providing that, and we need to. And even if it's costly, and we're searching for the money can be found.
Thank you.
You're muted, Peter. Were you inviting me?
Sorry. Jill, there's so many folks in the attendees who could add to this conversation. Is there any reason if they wanted to speak on this or the next topic that we could not make them panelists?
If you'd like to let me know who in the attendee list you want me to promote, I'm happy to do that.
Well, I'd just like for them to raise their hands if they would like to speak on this or our next topic, which is obviously related, which is diversions. So any attendees, I'm seeing a great list of people there, would love to hear from. So please raise your hands. You'll be made a panelist, and then I'll call upon you. Dean, please go ahead.
Yeah, the one thing I hope can come out of the workshop and that we can make use of is understanding where some of the process barriers are to people being able to avail themselves of the various diversion opportunities. And there was in our planning team meeting for the SIM, there was some discussion about the length of time from arrest to referral to mental health court and how long that process takes or whatever, for whatever reason. I'm hoping that there is in the workshop some discussion and analysis of why that is and then what we can do about it, as an example.
Great, thank you. I saw a hand. It was Wendy Jones. Where did you go, Wendy? Oh, there you are. Please go ahead.
I was basically just observing at this point, Peter, probably more on the next issue, but one of the things that I think is probably getting in everybody's way is that it takes so long for, let's say that you've got somebody who all indications are that you've got an individual who's mentally ill. They go to hospital because a lot of times Bellingham is really good. In fact, all of our law enforcement folks are trying to get somebody maybe detained up through the emergency room, but they're over capacity. And so jail is kind of the last place that they can go. And then they get into the legal system because, of course, if they are found to be mentally ill, then they can't be held accountable for whatever the behavior was. And that can take multiple trips down to Western State Hospital. And part of it is trying to figure out how to take very entrenched systems and get them to be able to move more quickly or to look at different ways that other states may be doing it in order to get somebody to some help fairly quickly. Because it's something, and I know that I'm 2 years out of working in the jail, but fundamentally it hasn't changed a whole lot. And a big part of it is, and the systems are set up to protect somebody's rights, which is a good thing, but then what you run into is very long delays, and the attorneys involved are up to here in some of their clients. So that was kind of it for right now.
Barry, please go ahead.
Yeah, I just wanted to, excuse me, chime in on Arlene's concern on the 23-hour crisis center. We are working on that through the state legislature as far as getting permission to have a dual license as we go into our BCC planning. And I know I just talked to Representative LeCountoff yesterday, and I'm talking to our lobbyists. In fact, I'm multitasking to make sure that we have some legislators on board for that legislative change that we're asking for next session, because it's a no money ask. It's just a policy change to be able to do that. So anyway, I wanted to say, Arlene, this is not dead by any means. We're trying to find a creative way to be able to do it and have it all contained within the same facility, so people can move from one facility to the other smoothly. But we still have that crisis center available with those 23-hour guidelines. So we are still working on it.
Thank you.
Dan, go ahead.
Yeah, thanks. Good morning, everyone. I just wanted to point out and kind of back up what the mayor and the police chief said about the lean budget environment right now. We're leaning towards an out of custody BCC facility, and the 23-hour facility is also out of custody, and that would enable Medicaid to pay for, in theory, if it's still around, for patients to receive services there. Um, I think that it's a major shift in policy thinking, and it's a choice that we are making here as a recommending body for the county council, and also vis-a-vis with the city council as well. So I just want us to be cognizant that that's going to fall in pre-arrest and post-arrest on the sim. So I just want us to be aware that we are leaning towards those decisions, and there will be implications for that, and both positive and negative. But I just want us to be aware of that.
Thank you very much, Dan. And Raylene, you go ahead, and then it's Tasha Thompson.
Thank you. I think one of the things, as we kind of move towards the diversion topic, and we've talked about pretrial services, electronic home detention, pretrial and post-conviction, how those resources are used, as well as lead and mental health court and recovery court. The one thing that I've not really seen the numbers that we've ever explored before, which I know happens, is cite and release. And I know law enforcement has been issuing citations for criminal charges for a long time and releasing them with the court date. It would be interesting to be able to see if, and I don't know how simple this would be. I know trying to gather data isn't an easy task. But if you were issuing those citations with the court date, how many of them law enforcement would actually prefer to book on because they've encountered this person for 7 or 8 times and now there is no capacity, so they just continue to cite and release and they ended up having warrants, or that they're just citing and releasing because they don't need to go to jail and that they can just appear with a court date and resolve in other areas.
Thank you, Raylene. Tasha, please go ahead.
Just to follow up on that, I'm hoping the sim will incorporate, like, as kind of echoing some of the other things with hard decisions having to come, an analysis of which programs are actually having the successes, the ones that have been set up for some time. Are they having the successes that we believe they would have? And if not, can those resources be spread to one that is having more success? And following on Raylene's comment on cite and release, I mean, cite and release is good. It would be a good thing to analyze whether or not what's the percentage of people that show up for their first offense or their first appearance after a cite and release, or are they more likely to not show up versus someone that maybe is booked on a misdemeanor charge, and then and just a book and release, within 24 hours or whatever. they're released with a court date. Is there a difference between those more likely to show up to court versus just a cite and release? Those are two different things that you can look at as far as effectiveness of cite and release versus book and release versus, and then you can incorporate giving us the option if there's other opportunities for behavioral health or an ITA to the hospital. How soon do you have contact with law enforcement again after those three different options for law enforcement? Those would be a good analysis between the three options.
Thank you very much, Tasha. Rosa, please go ahead.
I'm sitting back reflecting on what everyone's saying, and so this is from a personal perspective, and I think this is going towards in the direction of our agencies, multiple agencies working together, or not, in the sense of, say you have someone, I'm going to use a real person, but hypothetically, that makes sense. Someone that is diagnosed, that is truly mentally ill, but has a substance abuse problem, which then leads to them doing, like, say, petty crimes. So where does this person fall into? Because this person is also stating, like, is loose enough to say, hey, I'm not going to quit doing these drugs. There's no help for me, right? But they are diagnosed with a severe mental illness like schizophrenia. So do they just, but clearly I think from the, like, say, sheriff's police or whatever, law enforcement, like, they're like, well, this guy or gal is pretty ill mentally. So do they fall under that because they're drug users, or do they go to behavioral health? But then again, this person states, I'm just going to live my life. There's no hope or help for me. And clearly this person doesn't want help. So I feel like there's a number of people out there like that. So they don't fall under one or the other. So where do they reside? Thank you.
Thank you, Rosa. Miriam, thank you for joining us as a panelist. Feel free to go ahead, and then I think we'll switch to a related topic, diversions, and Melora can roll that out. We can have an ongoing discussion. So Miriam, please go ahead.
Thank you. Hi, everyone. My name is Miriam. I'm the executive director of the Whatcom Racial Equity Commission. And I wanted to just speak on, we got a chance to get a presentation from Hannah Fisk about the different models that were being explored. And when the commission was given two choices of in custody versus out of custody, they often kept saying, well, why can't it be both? Why can't we design something that has aspects of both so that it serves more people? Because we heard very clearly what were the pros and cons of both in custody versus out of custody. And, if you've worked in community, you know that our communities are extremely brilliant and imaginative. And so they're thinking of a system that we haven't even seen yet, potentially, at least locally. And so they really, really wanted to explore an option that provides both. And what would the cost be? And if the cost is too high, then can we go seek that money? So essentially, we're not having some people fall by the wayside because they don't fit into that perfect in custody or out of custody model. So that's just one thing I wanted to add. And one thing I learned recently from just being in community is that whenever you're given two choices and you're told that's the only two choices you have, to always ask, what's the third option? And to always seek a third option. And I know that there's so many constraints with funding, and also I really think if we're hoping to serve the community in a way that's long-term beneficial for everyone, it's important to seek those options as well. So just wanted to add that. Thank you.
Thank you, Miriam. Wendy, you go ahead, and then we'll move on to the diversions topic.
I'll keep it quick. Something that I suspect most of, if not all of the panel here today are not aware of a program that we ran through the work center for a number of years before funding got pulled, that for all of our folks who were either on the offender crews that went out with the folks that work for the work center and folks who were on work release, when they came back at the end of the day, there was treatment, substance use treatment that happened 5 days a week, and that everybody was required to go. Some of them went through this process. If they had long sentences, they would go through the entire program more than once. And what we found was that the recidivism rate of those individuals who had been given access while they were in custody under the minimum security groups didn't come back to jail. And it was one of those things at that point, Peace Health was providing the treatment provider. She was very good about working with the folks that we had in custody, and she was great at what she did. And we saw a sustained effect from that when they went out into the community. Peace Health pulled the funding for it, so the program stopped. And so it was one of those things. I don't know that I remember who said it, that we're talking about either in jail or not in jail. And this was kind of that in between part, because they didn't have any choice, but they had to go. And so when you hear it loud enough, that's the whole basis of commercials on TV. If you hear it often enough, that'll be how you react. So it is something that has worked well in the minimum security area, and it might be something that we're going to want to revisit. Thank you.
Thank you. Heather, go ahead.
Thank you, Peter. I just wanted to thank everybody for your input and feedback. We'll be hosting an event in February. We'll be releasing an application actually to people who want to attend, because yes, we need to update the sequential intercept map, and your feedback is so helpful for how will our community actually use this. We don't want this to be a document that just gets put on a shelf. And the planning team has been talking more about those handoff pieces, those in-between moments when we lose people through the system and when we're not able to track what are the outcomes and are people actually getting better. And my hope, just for the record, Peter, is that the right people get in this room to really look at, like, what are the top 5 high leverage handoff opportunities where we're losing the most people, that we don't actually need a new program. We just need different coordination or a barrier removed or a new policy. And there's already examples in our community of really awesome conversations that are happening. The crisis center conversation, Peter, that you led 12 or 14 months ago, that was really huge for just changing process and how many more people we've been able to serve because the right people were in the room having the right conversation. And so your feedback, we're going to take all of these notes and try to hit the mark that everybody has said they hope we'll get out of this. And my hope is that we'll bring back a renewed SIM with some of those opportunities for those high leverage conversations that we will use as a community instead of, I just don't want this to just live in a binder somewhere. So thank you, Peter.
Here, here. Alexis, if you could just hold your comment, I think it will fit just fine in our next conversation, but I'd love to roll that out. And then please feel free to raise your hand again, and I'd love to hear from you. I have asked Melora today to bring a list of all of our different diversions. I sent her one just to get the ball rolling. She and Hannah Fisk, I believe, put together a more full list, and I just wanted for us to have a conversation around diversions. We do a lot of talking about it, but rarely does it seem that we're looking at the full list and then asking ourselves which ones are particularly working well in what way. Each one has its own intention, and I just want to have that full conversation here. And so, Melora, would you please go ahead? And Stark, I do want you. You're very eloquent on your definition of diversion, and I'd like for you to speak to us today. Stark has a definition of diversion that might be different than some of the other definitions. So let's kick that off. Melora, go ahead.
Yeah, thank you. Yeah, as Peter mentioned, we want to have an educated discussion of what already exists, and this really dovetails really nicely with the sequential intercept mapping, right? We think about the SIM whenever we think about what we already have in the community. I think that there is continues to be different definitions of diversion, and that we often need to be asking, are we diverting from something and are we diverting to something? So those questions of diversion from what and diversion to what. And so, as Peter mentioned, Hannah and I took a list that he had already started and just kind of finalize that with our information. And so we can go through this. Can folks see my screen? Yep. Okay, great.
Yes, we can.
Great. And so this is, following the SIM to a bit. It's a little more detailed than this, but, as Peter said, talking about a shared definition of diversion, can we agree on useful categories and identify where current programs fit in? This is just a starting point. There are many people on this call that are going to have additional information, so we can use this. This is a draft document. So any questions before we start? I'll just run through all of these. Okay.
Any questions for Melora? Maya, go ahead.
Hi, thanks, Melora. I don't, at this point, this isn't a question, but I've been seeing, I think there was maybe a lead conference or something like that, where there was a term used that I hadn't heard before, and it was a term called deflection.
Oh, yeah.
Which I thought was really interesting, and I don't know the definition because I wasn't able to attend that conference. I don't know what was discussed or how it was defined there, but I thought it was an interesting term that we should maybe consider adopting alongside diversion and might give us more flexibility in our determining what definitions are. I think deflection is at a different point on the intercept maybe, and then diversion is someone who's maybe involved in the criminal legal system. So just to put that out there as an idea of a way to have some better definitions and timeframes for involvement.
Yeah, Maya, that's such a great point. I think that the conversation around diversion or alternative response, co-response, these kind of new innovative programs of the way in which law enforcement or the legal system may interact with individuals that are involved. Deflection is coming up more and more as a diversion and deflection or diversion/deflection. And so that's a great point. And I think that this group could, if the desire is to actually define it, like the IPRTF says, this is our definition of diversion, this is our definition of deflection, and are there other terms that are in there? I think it's also important to say that the IPRTF and the SIM is specifically about legal diversion, right? But we also have programs in our community that are also cognizant to diverting from the emergency department or diverting from EMS interactions. And so that's another piece that I think when we talk about our programs, when we're in this space, we're talking about legal diversion, but then some of these programs that also support legal diversion or deflection are also have an aim to reduce impacts to the healthcare system or EMS. So it does get a little murky. So the list, we'll just run through this. And I think if anybody has something that pops up that's missing, we can take notes of that and then maybe eventually have a final document that the IPRTF could accept. So pre-arrest, pre-booking, and again, if folks aren't familiar with any of these programs, there's lots of people on the call that could maybe answer questions. But in this category, we have LEAD, the Alternative Response Team, GRACE, Middle. mobile crisis outreach team, and that includes both voluntary and involuntary. So involuntary are the DCRs operating under ITAs. The Sheriff's Office behavioral health deputies, our detox center, which is acute withdrawal services, crisis triage, which is for mental health crisis, our hospital. And then in this category, we have the proposed Behavioral Care Center, or BCC, the 23-hour crisis center, and a proposed psychiatric urgent care. So again, those are not finalized, but they're in the mix.
Laura, would you do us a favor and go back to MCOT, and you defined what MCOT stands for, but a lot of people don't know, perhaps on this call even, what an ITA or a DCR is.
For sure. So just so everyone knows, in the state of Washington, each county is required to have a mobile crisis team and to have DCRs, designated crisis responders. In our community, those are operated by Compass Health, both involuntary and voluntary, and that's through a contract through the North Sound BHASO. And the ASO contracts in all 5 counties. Compass serves 4 of the 5 counties in North Sound. So voluntary means, if someone is in a crisis and they say, yeah, I really do need help, this team can be dispatched and sent out, and they can work with that person. They can do follow-up for up to 2 weeks. So it's a nice short-term intervention. That is a 24/7 team, especially now they have a new endorsement through the state, and that it allows them to transport individuals, which is new, and that's a big improvement, and also ask them to respond in a timely fashion with the hopes that they would be able to respond within 30 minutes. So that's the voluntary team. The involuntary team are the designated crisis responders. So those folks have been authorized by Whatcom County and the BHASO to function as a DCR, and they are able to basically say this person is so ill that their civil liberties need to be suspended, and we're going to involuntarily take them to the hospital for healthcare treatment, mental health treatment. It has a lot to do with the way that the ITA law is written, of whether or not a DCR can detain or not. And lots of times people will say, wow, we wait until someone is very, very ill to detain them. And I would say my professional opinion is that that is true, but that is the DCR's following the law and the way that it's written. And so there has been some, I think, movement around making some legislative changes to the way that ITA law is written in Washington State, but right now we don't have any changes to that. So if that person is taken to the hospital, then they end up going in front of a judge who decides if that person can be involuntarily hospitalized for a certain amount of time. And then the treatment providers work with the court to determine how long they are in the hospital against their will. The hope is that if they start to do better and are in a better state, that they may voluntarily say, I'd still like to stay in the hospital. And that's when they would switch from an involuntary case to voluntary. So happy to answer more questions. And there are people on the call that can help with this as well.
Thank you. Why don't you continue with down the list?
Okay. So post-arrest options right now, and if folks think there are other options here, we have lead and grace. At the prosecutor review point, prosecutors could decide to file charges, they could decline to file, and they could defer charges. Right here, we are proposing that we have a prosecutorial diversion program, or a PDP, that would be part of the Behavioral Care Center, and that would be co-occurring inpatient treatment. A prosecutor would have the ability to say, if you want to voluntarily go through this program, we would defer charges or decline charges. Arraignment pretrial, we have pretrial services. Again, we have the option for deferred prosecution, a stipulated order of continuance, the option to direct file. This is where our therapeutic courts can come in. We have recovery court, mental health court, family court, and community court, which is new with the city of Bellingham. And right here we have, again, the proposed prosecutorial diversion program. And for all the attorneys that are on this call, or legal experts, if I'm saying this incorrectly, just correct me. Post-plea deferred adjudication, deferred prosecution, again, behavioral health diversion. So this would be incompetency related and drug court. Going on now, we're at the sentencing part or post-conviction. We have DOSA, we have the mental health sentencing alternative, family sentencing, work release, school release, community service. There can be fine reductions. There could be behavioral health probation, deferred sentencing. I'm not super familiar with this BRIC, but it's on the list because somebody knows more about it than me. Ongoing participation and lead could be considered at this point, and then mental health court can also be part of that decision. Moving to juvenile, we have diversion agreements, teen court, the Community Accountability Board, and then in the last year, juvenile has had an opioid outreach behavioral health specialist that's been working with their young folks. And I saw Stephanie on here, so I'm sure there's maybe some things missing there. Under restorative and community-based, we have the option for mediation. And then when we get to reentry, various providers have peer support programs. We do have transitional housing programs, such as Sun House. We also have permanent supportive housing that is specifically for reentry. Citygate is an example of that. And then the work that goes on with the reentry provider in the jail and all the providers outside of the jail. So a lot of care coordination work there. And then we do receive CJTA rental assistance that we use to support people with housing. So again, it's a start. We know there's probably some things listed, and we do have a visual. This is, again, it's hard to try to keep all these things together. And I'm sorry, this it's kind of hard to read, but we can send this out. But this is also trying to help people understand how kind of where all of these things land in the legal system when it is law enforcement's decision of whether to divert or not, and when it goes to the prosecutor, when it goes to the bench. And then you can see at the top, we tried to put the intercept positions along there so that you could also match it to the SIM. So this is a draft document, something that Hannah Fisk has been working on for a while. The items, the boxes in yellow are those proposed things, right? So the things that we have actually been working on for multiple years, but are not yet true to the community. So Peter, I'm not sure where you want to take the conversation from here.
Thank you so much. That's a remarkable list for a small county of 240,000 people. I have a lot of thoughts, and we have time now to hear from everyone. You can see how related this is to our previous topic. Just looking for, as the IPRTF moves towards definitions, categorizations, looking for ways to measure, look at our data program and such here at the county, how we measure these, the effect of these things. It'd just be very interesting to have this conversation. And Stark, I promised you some time to speak on this topic. Why don't you start, and then we can go from there.
Thank you. Actually, you didn't promise me, you solicited me.
Okay. Yes, that's true. I pulled you in here to give us your viewpoint. So thank you.
Yeah, I agree with everything Melora just set out. Those are all great programs. They, to a greater or lesser extent, they all work for us beneficially in Whatcom County. And to a certain extent, my perspective on this is one of semantics. What is or what isn't diversion? And my strong feeling, and this comes from my own bias as the director of the Public Defender's Office, is that diversion is basically what keeps folks from having to be appointed to this office, keeps folks from having to have a prosecutor, keeps folks from having to have a judge. And you know, the term that I've been throwing around is true diversion, which is that the criminal legal justice system does not get involved in the process. And the only real way that you can accomplish that is prior to charging a case, because once a case is filed under Criminal Rule 3.1, a lawyer is appointed, a prosecutor is assigned, a court date is given, and anything that happens after that, whether it's recovery court, where it's a stipulated order of continuance, whether it is a jail alternative, none of that is true diversion. I mean, that is an alternative disposition of the case, but it is not diversion from the criminal legal system. And what I envision, and frankly, what I believe is necessary in this county, is for people to, particularly the prosecutors, to engage in programming that will divert people away from charges, away from incarceration, and away from the court system. And that can only happen prior to filing charges. So, you know, that's really what my focus is. And as you all know, for the better part of the last 3 years or so, I've been ranting about the fact that caseload standards for the public defender's office are going to make it very difficult financially and from a personnel standpoint for this county to comply with where the standards are going. And the only realistic way to do that is to figure out a way to divert people out of the criminal legal system and into programming that holds them accountable and provides them a way out of the situation they're in, you know, in a non-legal, non-court related way. So this is by no means a criticism of what we are doing now, or you know, the effect of LEAD or GRACE or all the alternative disposition programs. But in my view, those are not true diversion programs. They are alternative dispositions. The only way you can accomplish true diversion is prior to charging, and it can be post arrest, but it has to be prior to charging. I participated in a work group with Eric Sigmar, Eric Ritchie, and Judge Jones. And we came up with some ways that once the behavioral care center is in place, that people can be diverted prior to charging into the behavioral care center. I will just, you know, I was actually pretty surprised and gratified that Melora included the juvenile diversion program, because that is a program that's been in place for decades. And what it involves is juveniles that get arrested or probable causes established, and they are never charged. They are referred to diversion. They sign a contract through Northwest Youth Services. They do community service work. They pay restitution. They do whatever the contract provides. And if they complete that contract, they are never charged. And there is no earthly reason why we can't come up with a similar program for adults in Whatcom County and truly divert these people out of the criminal legal system.
Thank you so much, Stark. And Prosecutor Ritchie, if you would like to speak from the prosecutor's office's point of view, feel free at any point here. Who would like to? Oh, go ahead, Eric.
Yeah, sure. So, you know, I appreciate Stark's perspective, and you know, it's obviously from a place of helping his office and a place of reducing caseloads, which is, you know, admirable for sure. But it's also myopic. The term true diversion, I think, is I think a poor term for what's going on, what he's asking for. I think he probably really means something like complete diversion. Because what we've talked about, what Melora has described, is true diversion. It's true diversion from different things such as normal prosecution, incarceration, and even criminal records. It is true. It's not false. I think Stark's asking for a lot more than that. He's asking just that people not not go through the criminal justice system, not see his office, and I think that's probably, again, a poor term, referring to it as true diversion that he's asking for. Maybe complete would be better.
Um, thank you. And Alexis, I want to make sure that you have time for your question before we go any further.
Thanks, Peter. Not much of a question, but a little bit more of a reinforcement, if you will. What I'm seeing in the previous sim is a lot of this downstream treatment effort when it really needs to start happening upstream. And I think that's in alignment with what Melora and Hannah are working on, a bit of what Stark is getting at in his idea of diversion and reducing or potentially eliminating legal involvement. But it really needs to happen upstream. It doesn't need to be this afterthought of like, okay, well, now that they're in drug court or now they're in mental health court, let's get them services they need. And unfortunately, I feel like that happens all too often. I've been doing this about 7-ish years or so now, and that story just feels very repetitive. So just wanted to express my support in those efforts and thank you, Melora, and all who helped create that document. It's very helpful.
Well, Laura, go ahead.
I'll defer to Eric because I think he's going to respond to Alexis, if that's true.
Okay. Eric, please.
Thanks. Yeah, I just wanted to say that there's a different diversion for everyone. Not everything fits in one thing. Not, diverting everybody away from the system is not the perfect answer either. Some people need to have the court's involvement. They need to have the threat of jail to make sure that they do their treatment or that they actually get better, heal, so that our community can heal as well. I appreciate that we have a lot of different diversion programs. I think Stark's right. There could be more, and there could be some more complete diversion. But the ones that we have, I think, are not ones to just turn a nose at. I think they're effective. They're some of the best things that we can be doing at this time.
Very good. Thank you. Laura, did you?
Yeah, I just wanted to let Eric respond directly. I guess Alexis's point brought up an additional piece for me, and I'm thinking specifically about take the LEAD program, for example. Anywhere between 85 or 90% of the individuals that get enrolled into that program are experiencing chronic homelessness at the time that they enter the program. That's not part of our eligibility criteria that you have to be homeless. It's not a homeless program. It is a legal diversion program. And the fact that that happens consistently over the past 5 years tells me that if we aren't addressing the root causes and basic needs within our community, we are not going to make the impact in the legal diversion that we want to see. And in this space, I know that that's not the task force's mandate, but if we're talking about what's really going to make an impact and we're talking about prevention and upstream, we have to address some of those things. And I think it would be powerful if that was part of the analysis that the IPRTF kind of brought into their recommendations.
Thank you so much. Raylene, go ahead.
Thank you. I have a tendency to agree with both Stark and Eric in different ways, but I think when we look back at what the name of this group is, it's incarceration reduction and prevention. So is the diversion that Stark is looking at actually prevention to keep them out of the criminal justice system? And then the diversion that we're looking about is what's happened once they've already entered that. I think there's been some really great work. I can give a shout out to Miss Kraft for her education with me on some of the different areas that I've learned about in civil and how that intertwines with criminal. If we didn't have a minor guardianship facilitator, we wouldn't be able to assist the juveniles that need resources right out of the gate when they're still very young to prevent them from going into the criminal justice system. And so with her assistance, we were able to get a full-time minor guardianship facilitator. And although that's not criminal justice, it is preventing somebody from going into the system to making sure that their families have the resources that they need. So I think there's more of that civil area that we need to look at in this group to prevent them from even becoming a party to the criminal justice system. Thanks.
Thank you, Raylene. Alexis, go ahead.
Okay, this is my final comment, I promise. It's clearly a very charged topic. I just more so wanted to clarify. I'm not on a standpoint of, one perspective is more effective, et cetera, over another. I think this is really challenging for us to have discussion on and kind of create what looks like this linear model because the human experience is not linear. So there are certain programs where that is what is needed for an individual to change their life. And that is evident, and I've seen it happen with many clients. So just wanted to clarify that perspective because I think it may have been interpreted a little different. Thanks.
All right, who else would like to speak? Anybody we have not heard from yet? Scott Cortice, I know you and I have talked about diversions and such before. If you have any thoughts. Or Stephanie Kraft, Rebecca Mertzid, Scott.
Yeah, I guess pivoting on some of the previous comments, I I guess I want to know how well all the programs are working. Pivoting on data again, we need data that shows that they're working because some of these programs are quite expensive to run, and I just want to know how effective they are. And also to Melora, a great presentation, but as an outsider to some of this, we need a glossary of what all those acronyms mean. And you use them pretty freely, like you really know what they mean. But for me, it's like I'll just say in COG, the Council of Governments, we have to, if we use an acronym, the first time we use it, we have to introduce it. So, but if you would put at the end of your report a glossary of all of the ones you used, it would be helpful to me.
Well, Scott, I think there's no reason why we couldn't just beef that up with more naming the acronyms and maybe even a short description. Yeah.
I'm just thankful that Melora made the full and Hannah made the full list. I will do whatever work necessary to kind of take it to the next level so that this body can move forward with some of this work to make definitions and classifications and definitions. So Miriam, please go ahead.
Thank you. Will this list be shared with
Miriam, I'm not able to hear you. I'm not sure if that's true for everybody else. Could you try again?
It's pretty quiet.
Oh,
Can
you hear me okay?
Oh, Miriam, is that you? Go ahead.
Okay, yes, that's me. Sorry. I was gonna ask, will this list or the document be shared publicly or because
Oh, yes.
Okay, cool.
Yep.
And I also wanted to say to Scott's point about how well are the current systems working. When the commission recently did an analysis on incarceration data. We looked at racial disparities and we also looked at types of offenses. And one of the key indicators for essentially reducing incarceration is how well are the diversion programs working. And just on a cursory view, we couldn't find any information about the current diversion systems or diversion programs efficacy. So that was one of our research questions around, well, how efficient are these particular ones at diverting people from the criminal legal system, and how beneficial is it to the participants? And so that's going to be one of our next things we look at. We were recently able to get data on some of the diversion programs. So we'll be looking at what that looks like. So the other piece around data of like, if something is working really well, how do we scale it? And if something is not working well, what can we actually change about it to serve our folks better? So
very good. Thank you so much, Melora. And then we could take one or two more comments or questions, and then we should move on to the rest of the agenda.
Yeah, I really appreciate the comments about data and analysis of how programs are working. I am in that exact same camp. Mayor Cortice, I know you've said that many times. And to Miriam's point, I can only speak to the Response Systems Division, which has 6 different diversion programs. That doesn't include programs that are funded by the ASO or the state that operate in our county that we're not funding or providing the oversight or management of. And in all of our programs, we do a lot of reporting to our funders, right? We spend, as anyone that runs a program knows, that you do a lot of work to continue to secure your funding. Additionally, having public-facing data dashboards is the goal, and I personally have been working towards that for 5 years. But again, that would only be for the programs that Health and Community Services oversees. To expand that to services that we don't fund or operate is a very different thing that we would need to take on. And for those that are thinking about how we're measuring the Justice Project implementation plan, how complicated it is to measure data and to have the data to do that. The good news is that we were able to secure a nice chunk of money from the Healthcare Authority to do a 2-year evaluation of just the Response Systems Division programs. And that our solicitation is about to go out in January. So we'd be bringing on a third-party evaluator who would be able to evaluate how all of those programs are interacting with each other and the legal system and the emergency response system. I would love, because again, part of us spending that money to do the evaluation is to answer this question that I've heard for many years, that you all want more data and you want to know how the diversion programs are working. So if you have strong opinions on that, please reach out to me or Dean White, because we will be bringing on that evaluator soon. And by June of 2027, we would have a report on those systems. So and we will continue to work towards the data dashboards.
Thank you so much, Melora, and thank you for bringing that list today and running us through it. Anybody who has further thoughts on this, feel free to reach out as we move this project forward. Heather, do you want to take the next item?
Yeah, and for the sake of time, I guess we wanted to talk a little bit about our land acknowledgement. And I appreciate your comments, Peter, this morning about, really thinking about the words and not just saying them in a rote way. And I was given feedback a couple weeks ago about a land acknowledgement I provided. And it was really good feedback. And it made me think about the land acknowledgement that we state at the beginning of our IPRTF meetings. And I started digging around and doing some research, and the Lochtimish Foundation actually has a really beautiful land acknowledgement page. I was looking up, what does Lummi Nation and the Nooksack tribe want us to do? And Lummi Indian Business Council approved a land acknowledgement statement that we included in the IPRTF packet. And it is different than the one that we recite at the beginning of our meeting. This isn't before you today as a vote. I don't think we're ready for that. I actually would recommend that we bring the conversation to the steering committee a little more fully, and that if anyone on the IPRTF or on the FAB or on JPOP, those are acronyms I think we all know, Mayor Cortice, right? If you want to join that conversation, we welcome that, because we want to try, in the journey of equity and understanding cultural history and the appropriateness of government to government relations and honoring sovereign nations in our community. It's a continuous learning, and I don't think the point of all of that work is that you're never going to get it perfect and it's never going to be done. But based on this research, I think that it might be a good time for us to update some of our language and practices around the land acknowledgement. Peter, is there anything you'd like to add? And I'd love to just, if there's any brief questions or anyone that wants to raise their hand now to say, I really want to be at that steering committee meeting, go ahead. But Peter, add any other context that you'd like.
No other context. I thought maybe would you be interested in reading the proposed
I
land acknowledgement? And then just a heads up to folks. And yes, we'd love to hear from you before we move this forward through steering. And yeah, why don't you go ahead and have
okay. This was actually a resolution passed by Lummi Indian Business Council in 2021. And it was adopting a land acknowledgement statement for our Lochtimish people, derived from our worldview or cultural lens to become a written template to be utilized by A, school districts, B, government agencies, C, townships, D, organizations, and E, any other parties. The entire explanation is really beautiful and wonderful. And Jill, maybe you'd be willing to send a link out to the page. If you Google Lochtimish Foundation land acknowledgement, it comes up. So there's a lot of other things, but the statement itself that that Lummi Nation adopted is and insert name of school government agency. So we, the Incarceration Prevention and Reduction Task Force, acknowledge we are residing on the traditional, ancestral, and unceded territory of the Lummi people. The Lummi people are the original inhabitants of Washington's northernmost coast and southern British Columbia. They lived in villages throughout this territory and continue to have an ongoing relationship with these areas. Since time immemorial, they have celebrated life on their land, waterways, and on the traditional, ancestral, and unceded lands of their people to perpetuate their way of life. Please join us in taking a moment of silence as we honor their ancestors and as we acknowledge the past, present, and future Lummi people as the original inhabitants of this land. So different than the one we cite. And I think also there's a moment too where it's like it's really a lot more about what are the actions and the policies that we want to take to honor the Lummi and the Nooksack tribe. I think, this statement doesn't include Nooksack. And so I wonder about how do we get that right too? And I also do want to honor that there is, structural bias in the system that we're working on, right? That it might actually make sense for us to have a statement that addresses that as well, and the historical harms. And so I have no answers. I just have curiosities, questions, and humility about wanting to really honor the people of this land. And Rose, I see your hands raised. What would you like to add?
I like to be part of that meeting, but also I'm Lummi and Nooksack and Skagit, so I'm a lot of Coast Salish. So it would make sense to say Coast Salish peoples because, like before borders, it wasn't just Lummi here. It was Nooksack was up in BC, and I'm Jamestown S'Klallam too, which is by Squim. So we were up in BC, and we would have hunting and fishing villages over here in this area too. So I mean, I guess historically, all the Coast Salish tribes intermingled at some point, but shared common areas of where, like, this is where everyone would go pick huckleberries, right? Or this is where everyone would go deer hunting or whatever, elk hunting or whatever, right? So I like the aspect of just saying Coast Salish peoples because then you're not leaving any particular people out. That's just my opinion. Thank you.
Thank you, Rosa. We'll make sure you're on the invite for the steering committee meeting. That's really helpful feedback. Thank you.
Great. Well, thank you so much, Heather and Rosa. And we'll look forward to moving that conversation forward. All right, on to the next item. And that would be Marty and Holly who will be leading this.
I'll take it. Hi, everybody. In your packet, you received a draft of the 2026 year-end report that the IPRTF is required to submit. We're very grateful to have Jennifer Moonlight Solutions Consulting on our team, who did a lot of great work on this. And we just wanted to ask at this point if there's any feedback. We want to know if there's anything that seems inaccurate or incomplete. What's missing that we should add here. This is our chance, and then we'll edit again and provide you a final draft for approval at the December IPRTF meeting. So just opening it up for any input.
Anyone? I will say that I have read it and given feedback. I would really encourage you all to take the time to look through. It doesn't take too long to read the report, and there is a lot of good work expressed there. I just want to make sure that it's accurate, and happy to, if you have issues, take issue with any of the items. This is really the time to do that because we want a good, accurate, honest report here. So, Scott, please go ahead.
Go ahead, Scott.
Could I get it in Word format?
Yes.
Thank you.
Yeah.
Anyone else?
We can take written feedback like Scott's going to give. That would be, we're happy to do that too. And hopefully everybody knows how to reach me. Marty at crossroads.pro is the email.
All right. Well, thank you very much, Marty. And thank you to
Thanks, everybody.
Jennifer for having done the work of writing the report. I thought it was very well written and clear. So,
thanks.
okay. Our next item is review IPRTF priorities, goals, and action plan updates. Let's see, we have plenty of time to go through this item. We are also, we've got just 2 committee reports ahead of us. And then we have, before we have public comment and other business, we have a future agenda items topic that we'd really like to hear from you. It's about what the IPRTF should be addressing in the coming year. I think that we haven't really taken the time to shake loose some of those ideas. It's something I'm always thinking about. I know Heather is too. But we've got such a good group of people here. And what do you think needs to come to the table? So let's go back to reviewing our IPRTF priorities, goals, and action plans. Heather, before I move on, is there anything that you would like to say on this topic or in particular?
I would love to add, so on it's packet page 19, I think is the helpful chart to look at for this conversation. And my memory, Peter, is we wanted to, just as a reminder, we want to keep our goals front and foremost in our conversations. And always be thinking about what are we doing to advance these goals that we all agreed are the most important things for us to work on this year. And we're having conversations too and planning and steering about, are these still the right goals? And so if you look at numbers 1 through 10, I think this is just a time for any IPRTF member, whether through committee work or independently, if there are things that you've done or know of in terms of progress or barriers on those top 10 goals, this is a good time to bring them forward and share with the group. So I'll read the top 3 goals just for the sake of having the words in the room for our auditory. So number 1 is adapting best practices for designing and operating the new jail and behavioral care center to meet Whatcom County's specific needs, ensuring effective service delivery. Number 2 is creating a data dashboard to track key metrics and support data sharing between criminal justice and behavioral health organizations and the public, promoting transparency and informed decision-making. And goal number 3 is strengthening and evaluating diversion programs for justice-involved individuals with behavioral health and substance use disorders, focusing on improving outcomes, reducing recidivism, and providing alternatives to incarceration. Goals 4 through 10 are also very worthy, and just I'm not going to read them out loud, but if Jill, if you want to pull up packet page 19 to share on the screen, and then we'd just love to hear any updates or things that you'd like the community to know who are listening and each other to know about goals 1 through 10, any work or progress or barriers that you're facing. Peter, would you edit anything I just said?
Not at all. That's what we're interested in having a discussion about now. Always interested in those barriers. As I was saying in our first discussion, it's like each one of us does so much work in our own field, and there are these frustrations. And this is a great table, if you will, to bring those forward because often the solution to those issues is bringing the right people around the table to look for ways forward and working through those barriers. So, please feel free to bring up these issues that are plaguing you. So, Maya, please go ahead.
Thanks. Question on number 1, is the intention really to be adapting best practices or adopting best practices? Because I think you're not really supposed to adapt you're supposed to adopt them. Does that make sense? My question? Like, I don't think we want to change we're not trying to alter best practices to fit our needs because that wouldn't be
That's
working.
a good call out, Maya. I understand what you're saying, and I think you're probably right, and that's just us working fast. So thank you.
Who else has something to add to this list or anything from your work that you would like to bring up at this table? Dean, please go ahead.
With respect to number 2, I think what what continues to be the biggest barrier to that is the allocation of resources to actually staff and do the work of creating a data dashboard. And I just think we need to figure out how it is we're going to bring to bear the resources. I know that various players in the county and in various offices all have huge workloads, and nobody has the time to devote specifically to the work of developing a data dashboard and the underlying data collection and aggregation work that needs to be done.
Thank you, Dean. Others? Alexis, please go ahead.
I'd like to make a comment in regards to goal number 3 and the implementation plan and increasing capacity of existing programs. I'd like to just call out what's already been called out and address it again. We are going to see very tight budgets and are already seeing that within a treatment perspective. So the support that we can get from, excuse me, the county and other areas in respect to treatment is going to be incredibly crucial to ensure that we are not just looking at the capacity and making that work as effective as possible at this moment, but also when considering increasing it to meet the needs of the community. I think as it stands, we're already seeing a reduction in reimbursement rate from the HCA of about 1%, and this is before we really see the effects of changes to insurance. So that's all.
Thanks very much. I guess I'd like to say that on this topic, like going back to something Barry said towards the beginning of the meeting, we need to be going through a process soon of updating the implementation plan. It's been just an incredible backbone for us of moving projects forward. And I look forward to a process whereby we make recommendations to update that document, because it is getting to be the first two items really have been achieved, and we have made movement and need to reflect that, I think, in that document and make goals and strategies to meet those goals for our implementation plan. So, anyone else?
Peter, can I share some summary understanding of where we're at on some of these?
Yeah, that'd be great.
Just for the room to know, if you don't already. So for goal number one, Peter led a work group, and Hannah Fisk has been and Caleb have been really significant in uh, developing thoughtful recommendations about the behavioral care center. I think we've made good progress on number one, but I think a few people, Stark, I remember you said this at the when we presented to County Council a few weeks ago, that the cliche is true, the devil's in the details of actually how are the policies and programs and processes going to work together. But I think that we've made really good progress on number one as a task force this year. Number two, I think Bertie, you've been leading the charge on data, and Dean, thank you so much for sharing the barrier that this isn't really resourced work internally at the county. And so if we want to go a little faster, what are some of the creative ways we can do that using different resources? But I think it's number two for a reason. We can't make solid policy decisions without clear understanding of data and what's happening and why and who's in the jail and those root causes. Number three, the strengthening and evaluating diversion programs. I think that there's been a little more effort around that. Obviously, today we're looking at the SIM and listing out the diversion programs and starting those conversations at the task force level. But I think that that's also woven throughout the behavioral health subcommittee. And thank you, Dan, and everyone on that committee for all that work as well. And I believe that you have a reentry subcommittee too on the behavioral health committee. Is that right? Working on reentry practices.
Yes, they do.
Okay, I'm just naming who I believe is involved with each of these, just for the record. Peter, have we made much progress on goal 5 this year, the court reforms?
Never enough for my appetite.
Yeah.
But I would love for Raylene, if Raylene, are you still here? Is there anything that you would like to say for your committee on number 5? Or anyone else involved with the committee? Arlene, go ahead. You're muted, Arlene.
Actually, on number 2, I want to emphasize the importance of telling the public what we are doing and what we have done so far. I think it's a big priority because we are serving the public. We aren't just here doing a job, we are serving the public in some way. And we need to let them know what has gone on. Yeah.
Very good point. Thank you.
Peter, just to add on to number 5, there are certain things that we can and can't do. They're constitutional restraints that limit what the courts can do, and we must respect the judicial branch as an independent branch, as well as looking at other areas. And, we've looked at different programs that we have, what we can add to it. And unfortunately, there is a lot involved in what's financially feasible. And as said before, we are on lean times. So what can we do? And I think the data is also something that we need to look at. And, we've talked about restrictions in incarceration, and that is still real. And if we look at what's currently incarcerated and that they're still there on pretrial, those are the cases most serious. But that's also driven by not just the court, but partners in criminal justice, which is defense and prosecution. Thanks.
Thank you so much for addressing that. Heather, do you want to continue on down the list?
I do. I see Arlene's hand is up. Is that an old hand or a new hand?
No, I'm done.
Okay. Um, Developing systems to improve communication and coordination between behavioral health providers, working with justice-involved clients, ensuring seamless care and integrated service delivery. I'm not sure if anyone is taking the lead on that or if that's embedded in our behavioral health and justice subcommittee joint meetings. But I do think that the SIM update and the conversations in that room will really support advancing Goal 6. And if you have anything to add as I keep talking, raise your hand and I'll call on you. 7, researching and recommending best practices across IPRTF domains to improve effectiveness and drive system-wide improvements. That is actually really our charge as the IPRTF and embedded throughout all of the work that we do. 8, identifying additional facility needs to support individuals with behavioral health and substance use disorders at risk of incarceration, ensuring resources are aligned with community needs. I think that Hannah and Melora, the work that you have been doing this year has been really important for Goal 8. And I would probably add for next year, scaled at the budget available and prioritized as well. 9, expanding supportive housing for individuals with behavioral health issues and a history of incarceration. I believe that work is embedded in the behavioral health subcommittee, but maybe could be more robustly advanced potentially. And then number 10, periodically updating and applying the SIM, prioritizing key gaps identified by subject matter experts to reduce the jail population of individuals with mental health and substance use disorders. And Goal 10 will support many of the other goals, and that is scheduled for February. So I think we've actually done a really good job this year working on all of these goals that were identified by all of you and voted on by all of you. I'd love to hear if there's any other comments, just for the good of the order. Melora, go ahead.
Yeah, thanks, Heather. Just on number 9, I feel like we don't have good representation on the housing movements in our community on the IPRTF. And if this is one of those goals, I think it's there's a subject matter expert gap in that piece. And I would recommend equally having the city and the county represented in that, because there's a lot of things going on that are 1, 2, 3, 4, 5 years out that will make an impact. But I could be wrong, but I don't think the members kind of represent that work.
Thanks, Melora. That's really helpful.
That's a really good point, and we do need to address that.
I hope you all feel really proud of the work that you've engaged in this year and supported through the IPRTF. I know Peter and I are both, one of our only resources we can't renew is time. And you're here on a Monday morning of a holiday week, and you are what makes this excellent. So thank you for all of your work. And if you have more energy and passion and capacity to do more, we welcome that and invite that always. And just want to express gratitude for the incredible work you've all done this year.
And I echo that sentiment. Thank you. And thanks for taking us through that list, Heather.
Yeah.
Let's have our committee reports because I guess November was a month where some of our committees were not meeting. We have 2 reports, steering and J-pop. Barry, do you want to take steering? Barry Buchanan.
Yeah, I'm here, Peter. I had to work my
Great.
way back from another screen.
Yeah.
Thank you. Yes, steering committee, this month we had a big conversation around our role as the uh, Law and Justice Council. And we went through the kind of the ordinance, or I mean the RCW for that, and Heather kind of read that aloud, and we started to kind of digest, what the state requirements are for a Law and Justice Council, in addition to, of course, the work we're doing as the IPTRF. So more work to be done. It just was kind of the first conversation that we've had in steering about that. But I think it's important to recognize that that is a role that we, by law need to fulfill. So we will be looking at that closely. The second thing was actually something I'm just going to pass back to the co-chairs, and that was on our future agenda items for the full task force. And it was a very robust conversation. I think that's kind of what led to this item being on the task force agenda for today. So I will turn it back over to Peter and Heather.
Heather, do you have anything you'd like to say on that matter?
No, I'm having a memory lapse, honestly, Barry, about what we talked about for future agenda items.
Well, I
I
think that
I think there was just a ton of them, and then
yeah.
I mean, obviously we have an agenda item today that's
Yeah.
talking about that. I just assumed that you guys moved that forward because we did have kind of a lot of ideas were flying around. I don't think we landed on anything, and that was kind of the reason we scheduled this for today.
Got it.
That's
Mhm.
my recollection.
Thanks,
And
Jay.
and also we have had discussions on two pretty important topics: the sim and
Yeah.
diversions. So
Yeah.
all right, great. Tasha, are you giving us a report on J-pop?
Actually, I am, Peter.
Oh, Holly.
Yeah. Ready?
Yes.
Okay. So, Holly O'Neill here, uh, along with Marty Solomon, who are helping facilitate the J-pop with Tasha and Hannah Sloan as our co-chairs. And the meetings have been awesome, really well attended, and very rich. So I'm going to give a quick update on our last meeting. And Jill, if it's okay, I'd like to share screen. So here we are. Can you see the PowerPoint? From start. There we go. Yeah, everybody can see it. Yes? Great.
Yes.
Okay, here we go. So this was what we covered in November. We just had our meeting last week. So we debriefed the October presentation, which was a panel discussion, and a presentation from Heather on the All Hands Summit. So first I want to just do a shout out to Heather and the Community Health Foundation for just all their work in this area. And they did a great overview of the reentry, or the All Hands Summit. And then we had some panelists. So we talked about that. And then we had an excellent presentation from the Whatcom Racial Equity Commission with Miriam Karamoko, the executive director, and she had Leo Aguiano there, if I'm saying the name right, their data analyst, and that was awesome. Then we did a review of the Q3 2025 progress report, and we worked on our action plan for next year. So these were the reflections on the October panel. Sorry, my voice is a little harsh today. But it was just I really appreciate people showed up prepared, and we had a great reflection on the panel, right? So we do a panel, then the following meeting we do a reflection, like, so what came out of that? What are people seeing as the key points, and how we might move towards solutions? So some of the reflections just to highlight are this continued issue of siloing of the providers and the need for more coordination, and the feeling that this SIM intercept mapping process, I'm on the column of moving towards solutions, we think will be really helpful for that. So a shout out to Peter. Thank you for you and Dean for bringing that forward. So I think that's going to be a really important process for us in 2026. Then this issue about the timing of release from jail, and that what we've seen in these last panel presentations is just so important, how important it is that when people are released from jail, they have somebody there to help them transition right away. And so that might be a policy issue we look at. There's a couple of technical issues we've identified, and one of them that came up is, this is the next line, there's only one courtroom for the district and superior courts, which can lead to some delays, which impacts timing. So the suggestion that really feeds into the jail design is 2 courtrooms in the new jail could really help that as one potential solution. There's more support needed for people who want to make change. And 2 things that we have heard now over the last couple meetings that really got defined this time was just the key importance of more mentors and peer support and allies in the system, both, when people are in jail and when people are getting out of jail and then continuing beyond that. And also this suggestion, it came out especially if you remember the focus groups we did for people who are currently incarcerated, is that it's really helpful for when people are in the jail to have, be with others who are also working on creating change in their lives. Needing for more housing, education, and healthcare. So we talked about learning more about the PACT program and tracking Medicaid, and just that ongoing issue about just needing to really know, how well are our programs working, which we've talked about earlier today. And then in terms of process, just involvement, continued involvement from people with lived experience, and just measuring that the services reduce incarceration. So that's what came out of our reflections on the October panel. And then we heard, like I said, this awesome presentation from Miriam and Leo on the findings when they're putting together the data that's coming out of the sheriff's department, how we're still seeing this issue about racial disparities, and the direction this is going is not going down, it's continuing the trend up. So we talked a lot about the data. We dug into sort of what do we know, what do we not know, and obviously this is a conversation we will want to keep on pursuing. And then we reviewed this we get these quarterly reports, and Marty, I just wanted to do a shout out. Marty does an amazing job of taking the material that comes out of the executive's office and then putting it into a nice, clear format that then goes up on the website, right? So that people can really see like what the Justice Project is, and then progress on each of the 15 projects in the implementation plan. So just, it's not, someday we'll have our data dashboard, but in the meantime, we have this just showing progress, which I think is really important. And then, we'll keep moving from there with, what data we can get up online. But that's that. So, and I encourage everybody to take a look at it. It's really helpful for just keeping track of where we are. So that's the 3rd page, and it always, of course, refers back to the county executive's, full report. So people have that for reference. And then lastly, honoring Tasha's commitment to in-person meetings and the joy of cookies. We're going to have our next meeting of the J-Pop is December 18th. We'll be gathering in person, and all of you are welcome to come, bring some cookies. We're going to talk about the highlights of the November 20th Community Engagement Workshop about the jail and BCC. Shout out to Barry and to Peter and others who helped work with our contractors, the contractors for the jail PCC. It was really well attended. That was back on the 20th there in Ferndale. We're going to discuss the data dashboard development and then review and approve our committee action plan, which we got some initial thoughts on and we'll continue to refine. So that is our report. Thank you.
Fantastic. Thank you so much, Holly. Really appreciate it. Barry, go ahead.
Yeah, I just wanted to, since Holly mentioned the engagement meeting that we had last week with the community, I just wanted to give a real quick update. It was Riley reported that there was 97 members of the public signed in, and many more got past him, he said. So we had well over 100 people from the public that attended. Um, I did a one complete lap, took me almost an hour. There was so many people that wanted to talk to me about and engage with questions and comments. To me, it was super, super successful. And I'll tell you, if you see Riley or have a chance to thank him in any way, he just knocked this thing out of the park. And everybody needs to recognize that. So, yep, that was a super, super good effort. And I think going forward, we're going to have two more of those next year. And I think we're going to build on this one. They're going to be even better and better. So, excited about that.
Great. Thank you, Barry. It really was a terrific event, and I very much enjoyed talking with many, many members of the public about all the work that's being done. And also, again, kudos to Riley, who did a great job helping pull things together. So, let's see, we are running out of time here. I would like to do public comment first and then take just any few minutes we have to complete our agenda. Is there anyone, there's nobody in the room with me here. Is there anyone online, a member of the public who would like to speak? Raise your hand. All right, seeing none. In the last few minutes here, I'd love for any of you to bring up subjects that you would like for the IPRTF to bring up on our agendas, whether it's discussions, presentations, roundtables, whatever it might be. And we will put them on our list. Or any other business that you'd like us to attend to in this meeting. Heather, go ahead.
One thing I wonder about is that goal around court reforms, and if there's an opportunity at the task force level to, just like we did today with defining diversion and really getting terms out on the table and understanding. I think that would be helpful, whether it's a subcommittee or a full task force conversation about what even does court reform mean? What could opportunities be? There's like big capital R reform, and then there's probably also smaller process, program, procedure, policy reform that is actionable. So I'd love to see that at some point come back to the task force. And then I want to piggyback on Barry's summary from steering committee. We spent a lot of time on that RCW and the task force ordinance conversation. And I do think that's really important because there is opportunity with the Law and Justice Council enabled by state law for us to do, I think, even more and add on kind of a section of agenda items that are much more law enforcement system specific, but really critical, obviously, to this conversation. And I think that RCW even enables us to ask the state for different resources and technical assistance depending on the topics. So I'd love for that to continue to be a steering committee conversation as we navigate what are those opportunities and what makes sense to come to the task force as a whole.
That's great, Heather. I would like to see that as well. I do see a hand up. There we go. Yes, please go ahead. That would be W. Hello, go ahead.
Hi, this is Debbie Arthur. I am the new EMS manager taking on Mike Healy's position. And I just wanted to introduce myself, say hello to everyone. We do quite a bit of the upstream prevention with some of our programs, the community paramedics, opioid overdose, and we're falling in line with Melora and learning a little bit about what she does and how we can help. So I just wanted to introduce myself. I've only been here, I think this is my 6th week, so I'm very new, but I've enjoyed this meeting and hearing more about all the work that you all have done this past year. And kudos, it's been amazing to hear. You should be very proud.
Fantastic. Well, welcome. Thank you. And the next meeting, perhaps we should go around and to each person and introduce ourselves and what it is that we do. So let's put that on the agenda for the December meeting. And with that, I would like to close out the meeting of the Incarceration Prevention Reduction Task Force and Law and Justice Council for November 24th, 2025. And thank you all for all the good work that you're doing in the community and on this committee. Thanks so much.
Thank you.